child health nursing subject. Okay, in that fourth chapter, the chapter name is the disorders and health problems of a child. Okay, here one disease condition, that is the child abuse. Okay, in previous videos we have discussed what is meant by child abuse. Okay, child abuse nothing but in childhood stage the child will be undergone some of the harassment. Okay, with the planning only the child will be undergone some type of harassment. Okay, in that child abuse so many types is there. Okay, what is that? Physical abuse or sexual abuse or emotional abuse, sometimes neglect. Okay, these are the abuses types is there in the child abuse. Okay, in that physical abuse the child will be undergone some type of harassment, okay, like burning or shaking, or the child will be keep in the dark room, or the child will be tie up with the hands to the chair. Okay, like that some type of harassment is there in the children's. Okay, that is the physical abuse. In emotional abuse the child will be undergone some type of emotional disturbances or some type of bad language. Okay, they are undergone some type of emotional abuse. Okay, sometimes sexual abuse means in the childhood stage the child will be participate in the sexual intercourse for the profit. Okay, for fulfilling their basic needs. Sometimes the parents also encourage for the children for participate in the sexual abuse. Okay, these are the types. Sometimes neglect means unwanted pregnancies or more number of children is there in the family. The time the family members or the parents will be neglected the children. Okay, these are the types is there. Okay, here in this video we are going to discuss about what is the management for the child abuse. Okay, how we have to manage means here the first management is the depending upon the type of abuse. Okay, we have discussed the type of abuse like physical abuse or emotional abuse or sexual abuse or neglect. Okay, these are the types is there. In that which type of abuse the child will be undergone. Okay, that will be identified depending upon we are giving some type of management. Okay, next step is here hospitalize the child. Okay, in that physical abuse the child will be undergone some type of burning, okay, some type of beating. Okay, when the child will be undergone severe physical abuse, okay, then the child will be lose their consciousness. Sometimes the breathing will be difficult or sometimes bleeding from the body parts. Okay, like that some injury is there in the physical parts. Okay, when the severe injury is there in the physical part, okay, immediately the child will be hospitalized, means the child will be admitted in the hospital. Okay, next step, according to that after admission into the hospital, according to the symptomatic treatment, means if breathing difficulty is there, means we have to provide for improving or for maintenance of normal breathing. Okay, or if any wound formation is there, means immediately you have to give wound care to the wounds in the body. Okay, next we have to do the some proper dressing to the body parts. If is there any bleeding in the body parts, that will be done. Okay, according to the symptomatic therapy we have to provide it after admission into a hospital. Okay, next one is the keep away from the home temporarily. Sometimes the child will be abused with the family members only. Okay, why? Because the family members in the mother will be secondary mother. Okay, the primary mother means the first mother will die due to the some problems. Okay, the father will marry another woman. Okay, the mother did not doing any care or loving affection. She is not providing to that particular child. Okay, the time the family member only can cause some type of physical abuse or some type of child abuse in the children. Okay, that in that situation we have to separate the child from the home. okay, temporarily, when the child will be recovery from these type of abuses, okay, some time will be taken for this recovery. Okay, in the problem is there in the children only, we have to provide behavioral therapy or the speech therapy or emotional therapy to the child for recovery to bring normal health. Okay, if problem is there in the family members, means some type of harassment by giving planning or okay, they want to give some type of abuse to the children, means as a nurse we have to give some type of health education to the family members only. Okay, you are not giving some such kind of emotions or such kind of abuses on the children. Okay, you don't give, the child will be suffering so much of health problems. Like that we have to encourage the mother. Okay, don't give this type of child abuse in the children. Like that we have to give some modifying their behavior. Okay, next one is the behavioral therapy. Okay, according to the problem is arise within the family members or within the child, or the problem is arise in between the children and parents. Okay, where the problem is arise. Okay, sometimes in social situation in the society also the child will be abuse emotions or the sexual abuse. Okay, like that the problem is there. Whether as a nurse where it is present. Okay, the problem is where it is arise. Okay, which is the first primary source for the problem arising, that will be completely eradicated. And the child having any emotions or any negative behavior is there, that will be modified by providing good guidance and counseling to the children. Okay, if the parents only having negative behavior on the child, means as a nurse we have to provide good guidance and counseling for modifying their negative behavior to the positive behavior, that will be provided regarding health education. Next one is the normalized thinking. Sometimes the child will be thinking, negative thoughts, means the parents will doing some favor to the children, means the child will take negative. Okay, this is only benefit for the parents. By doing this activity we are not getting any benefits. Okay, by doing this activity my parents only getting good benefits regarding this situation. Like that the children will be having or thinking negative thinking. Okay, some types of negative thoughts is there in the children's. Okay, as a nurse we have to provide or we have to improve the positive thinking on the children's. Why? Because those are parents, those are your servants. Okay, those are giving complete care to you. Okay, they are not having any benefits by doing this activity. Okay, like that the clear information we have to provide to the children. Okay, for improving positive thinking. Okay, for reducing negative thinking on the children. Okay, next one is the evaluating the language. Okay, is there any negative language? Sometimes they are using some hard words. Okay, they are giving some type of torture on the children. Means the parents they are using such kinds of language on the children. Okay, you don't want me. Okay, you are an unwanted person. Like that they are using some type of language. Okay, as a nurse we have to give some type of guidance and counseling to the parents. Don't use such kind of language on the children. Why? Because they are kids. Okay, we are developing their health or we are giving some type of protection to the children. Okay, like that we have to improve the parents for how to provide, how to protect children. Okay, next one is the problem solving technique. Okay, is there in the problem in between parents or the children? How to solve the problem? What is the way? What is the better pattern for reducing the problem? That will be explained to the children and parents. Okay, next one is the focus on family members means the problem is arise within the family means as a nurse we have to give good advices to the family members only. Okay, how to protect your child from the child abuse. Regarding that, we have to give some type of advices to the family members. Okay, next one is the unpleasant emotions is having children like sadness or the angry. Okay, for improving pleasant activities or pleasant emotions, we have to work. Okay, now how to improve or how to modify unpleasant emotions on the children's. Sometimes which is the favorable or which person is favorable for the children's, those persons is communicate with the children's, then the child will be forget their unpleasant emotions. Okay, that type of environment we have to provide it to the children's for reducing their negative emotions. Okay, next one is the own negative thoughts. Okay, sometimes the child having some type of negative thoughts is here not there any negative situation or the family members or the friends or nobody can hurting him, but he is only imagination of negative thoughts in their own body. Okay, that time we have to evaluate. Okay, this is belongs from you only. Okay, the problem will be solved by you only. Okay, nobody can hurting with you. Okay, like that we have to give clarity to the children's. Okay, next one is the rewarding positive behavior. Okay, sometimes the child will be improving positive behavior means we have to rewards, we have to provide some type of rewards for some type of gifts or ornaments which is favor, which is like, okay, which is the desire of children. Okay, that will be provided to the children, then the positive behavior should be improved on the children's. Okay, next one is the encourage and rewarding the positive thinking. Okay, if the child having any positive thinking, immediately we have to reward the children's. Okay, next improve the parents and child interaction therapy. Okay, sometimes the child will do some good activity or some activity, immediately the parent will be receive and provide KMC, kangaroo mother care, like that. What is meant by kangaroo mother care? Like means by touching or kissing or some type of smiliness or some type of happiness on the children's. Okay, in front of children's we have show some type of expressions means the child will feel happy. Okay, sometimes the parent will doing some activity in front of the children means the child will happy. Okay, how to interact one to another. Okay, how to open their feelings in front of parents or how to open the parents feeling in front of children. Okay, the type of interaction or the communication we have to improve. Okay, every two persons, in between two persons, every person is opened or sharing their feelings or communication in between the two persons means, okay, they are reducing their negative emotions. Okay, they are happy. Okay, next one is the improve the parent and child relationship. As a nurse, we have to give some type of information how to improve parents and child relationship. Okay, what is the better way? What is the best way for improving the relationship? That will be provide complete and clear information to the parents and children. Okay, next one is the prevention. In this prevention, we have to do helps the parent teach the child how to protect against the child abuse. Sometimes the child will be neglect means they are missing from the school or they are coming late from the school. Why you are come late to the home means the child will be give fake answers. Okay, I am having some studies or some extra class, like that they are giving fake news. Why? Because the child will be not interested for come to the home. Why? Because the parents will give some type of harassment to the children. Okay, when we are not providing or when we are stopping harassment on the children, then the children will forget or the children will not give any fake answers to the parents. Okay, when we have provided complete freedom to the children, then the child will happy. Okay, the child did not get any child abuse problems. Okay, next one is the learning about touch never secret. Means when we are give or when we are freely movable in front of the children, the child never get or never keep secrets in their mind. Okay, sometimes the child will keep their own mind, some information will be secret. Okay, when we are freely movable in front of the children, the child will be open. Okay, the problem is this. Okay, sometimes the friends will be harassing me or some other persons will be harassing me, like that the child will be opened in front of the parents, when the parents should be give freedom to the children. When the parents will be strictly rules or regulations will be give to the children, means the children should not open. Okay, next one is the talk about any sexual abuse. Okay, any sexual abuse or any problem is there, that will be asked regarding child. Okay, is there any problem, means immediately we have to reduce the problem. Okay, as a nurse or as a parents, we have to protect the children from the child abuse. Okay, first step we have to improve the freedom to the children. Okay, we are never give any harassment or any physical harassment on the children. Why? Because the children not having mind development or maturity in their body. Okay, next as a nurse or as a parents, we have to improve good protection or good attention on the children. Okay, what is the basic needs of the children? Okay, how to improve their health. Okay, what is the needs of the children? As a parents, day to day life, we have to observe the children needs and necessaries. Okay, what is the desires, what is the likes of the child. As a nurse, we have to always fulfill the basic needs, likes, dislikes. Okay, next what is the child interest, that will be fulfilled as a parent. Okay, don't give any harassment or any torture to the children for protecting the child. Okay, this is regarding management of the child abuse. Thank you everyone.